University of St. Joseph's is now the seventh school here in Connecticut to join Hartford HealthCare's Campus Care program. The partnership set to bring accessible healthcare services directly to the campus community. Joining us this morning, tell us more is Vivian Pereda, Director of Campus Care Operations at Hartford HealthCare. Vivian, thank you so much for joining us this morning. And can you start off by telling us a little bit about this partnership and why it's so important on both sides?
Yeah, well, thanks for having me. So, as you said, this partnership is now the seventh school in the state of Connecticut that Hartford HealthCare is bringing this campus care program to. And so, what that means is that Hartford HealthCare will be providing students with health services in student health and counseling. And we already have an existing relationship with the University of St. Joseph's for their sports medicine program. So, students are now part of Hartford HealthCare's integrated care system on campus.
Now, specifically, what are some of the services that these students now have access to?
Yeah, so in the Student Health Center, we'll be bringing in some technology and innovation to allow students to have access to a virtual care provider, to have services that they couldn't have before, and be able to receive allergy shots or vaccines and immunizations if they're going to be traveling abroad. And in our counseling space, we'll have some more preventative and proactive initiatives as well.
Now, this is very exciting that I'm learning that there's also a mental health care component to this partnership. Can you talk about that?
Yeah, so we have been seeing an increase in demand for mental health services in volume and in acuity. So, what this partnership will mean is that Hartford Healthcare will be able to continue to provide traditional services that students receive for counseling on campus. And then, in addition, we'll be able to coordinate care for those students in more acute settings into the communities. And it'll allow us to have warmer handoffs and decrease wait times and improve access for those students with mental health needs.
You brought up the two words coordinated care. What exactly does that mean for the students?
Yeah, so what that means for the students at the end of the day, they're going to have improved access to care on campus and in the community when they need it. So decreased wait times for them. They're going to be involved in their decisions. They'll have access everything that they receive on campus. They'll be able to see in their medical records, and they'll be part of the process. You know, these are young adults navigating healthcare maybe for the first time, and so that involvement is really important for them so that they can, thrive and take ownership of their own health.
Vivian, thank you very much. Congratulations and best of luck with school number 7.
Thanks for having me.